Hello, I'm Dr. Bill Wyatt, and I'm a general dentist. I've limited my practice or have done nothing but orthodontics and TMJ work since 1970, and I'm a member of the American Orthodontic Society, and I strongly recommend if you're a dentist, general practitioner, or a pedodontist doing orthodontics that you uh, become a member of the American Orthodontic Society. It's a wonderful group and they are able to help you in many ways. And we are devoted to teaching orthodontics to general dentists and pedodontics or dentists that are interested in orthodontics. I'm going to pass on a few things I've learned in these many years of doing orthodontics. And I'm going to talk about the Big Daddy arch wire. That's something that I came up with many years ago to expand the arch in a very simple, easy way. And I'll try to go through that. I've got several cases here that's going to take some time, so I may split this up in two different sections. Uh, we, let's see, I've got to get this thing, go right here. Okay, there's a little flaw right in there. The Big Daddy arch wires are actually 040 or 036 wires that are just plain round stainless steel wires, and you can even use an 030 if you would like to. We can hook these on top of the regular arch wire and expand most anybody that you want to. This is just the amount of activation you put in these wires. Like if you make them to fit and then you activate them a certain amount and you pull this side in and tie it where you want to. It's usually bring it back to the 6-year molars back here. I'll show this in more detail here in just a minute. Uh, let's see. Uh, Here is the what we call the Big Daddy arch wire. I don't know. I started making them, and somebody called it a Big Daddy arch wire, and the name stuck, and so everybody calls them that now. And it can be called an overlay or just an expanding arch. It's really quite simple to put them in. Now, if you're putting them on the upper and you don't have the second molar back here banded or have an arch wire coming back to it, then you need to put something on this that connects it to the 6-year molars. You bring it out, you want to bring this tooth out also. Sometimes this tooth might be out, the others need to go to it, so you don't have to worry about that. Now, here is a little illustration of the amount of force when you construct this. And now the upper one, I put in the headgear tube right here. You see we insert it there. And when you first start off with these, you really shouldn't expand them very much till you get a patient that's is going to come back, because if they just run off for 6 months, they'll have their teeth out there where the arch wire is. It's a tremendous expanding device. Now, once you start expanding with it, it just kind of tips these teeth out. It doesn't bring them out bodily. So when we really develop an arch like that or want to expand it a lot, we'll put root torque in the upper molars. In other words, you'll have the rectangular archway in here, and you'll have a torque in the molars and bicuspids and everything that's bringing the roots out as you pull the crowns out, so you can move this apart without tipping the roots back here. So you bring the teeth out more as parallel. You can tell if you're doing that if the lingual cusp is lower than the buccal cusp, then you're tipping the tooth too much, so you have to put more of this reverse torque in the rectangular arch wire to do this properly. Now, a lot of times the teeth will be tilted in. If they're tilted lingual, then you just bring them out. You don't have to worry about the roots. They're already out there, see, so sometimes you don't have to do that. Now, the force, when you build this wire to fit to start with, and now you, after it's built and fits, you take it and just expand it out to whatever you want to, whatever you feel like you can watch this patient and take care of it. Now when you pull it in, you're going to have most of your force back here on the molar area, and you'll have some in the bicuspid and a little bit up here, but virtually none in the front. The front just rides along, keeps it from going up or down. You tie it on up here in the front, and then you tie it to whatever you want to expand. Now if you want to expand more, say in the cuspid bicuspid area, you would make your arch wire fit and be out away from those teeth, and then come into the molar teeth right here. So when you activate it and you bring it back in here, you'll have a gap in this area right in here, and you tie those teeth to it and take most of the force expanding these teeth and very little expanding the molar tooth, and it'll expand the arch in any area that you want to do that. So you can expand different sections of the arch wire differently with this. It's a very simple wire to make, costs virtually nothing compared with all these fancy gadgets they put in the pallets up here, and you can bring the teeth out and really control where you put the roots and where you put the crowns with this. So I think it has a lot of potential. If you try using it, it will surprise you what you can do with this. Now on the lower larger Big Daddy wire, we come in down on the bottom and make a loop, something like this, and then we crimp it down, and we tie that between the two molars. We have a molar here and a molar. Well, that's not a very good illustration of it, but in other words, this would be on the arch wire between the two molar teeth in there. That's a pretty bad illustration there for you, but I'll try to show it on a deal. Now this is just a plain stainless steel arch wire, just very simple thing. That's the lower one. Now here on the lower, we would come in, and you've got these teeth banded. You need to, if you tie it in here, you need to have an arch wire that's stiff enough to where it won't pull it out of the brackets or the tubes by expanding it. The arch wire has to be fairly stiff, so you wouldn't want to put it on anything less than 016, preferably 018 or something like that. Arch wire is round wire. Now if you're doing a lot of expansion, you need to put a rectangular wire in here first to get it, and then the rectangular wire you'll put what we call buccal root torque in the tooth, and which you would have to have an arch wire that you would flex and put into the deal. As this flexing we've got in this torque, then it would tend to bring these roots of these teeth out, you see, in that fashion, because as you pull it out with this, it tends to tip the crowns in this direction, and on the lower arch, the lingual cusp would become higher than the buccal cusp. You can kind of tell that pretty quick if you need this. Now, if you're just expanding a small amount or one or two teeth, you don't have to worry about that going in there. Now, that's the lower one, and we tie it with an 012 stainless steel or soft stainless steel wire. Run it under there and bring it over and kind of twist it down, push your twist in underneath there so it won't irritate the patient. Now this wire will fit kind of underneath the bracket of the 6-year molar. And then sometimes we bring it in or something where it'll lay on the arch wire more. We'll show you that in another slide here in a minute. That's a little close-up of the tying of that. Now when you're bending this wire, this is an 040 wire. It's a big thing, and you bend it with a plier that's not just your tweed loop forming plier, but we use a Lewis plier, which has a larger beak here, and you're not right to break it. A lot of times the wire, you can't hardly bend it down where it touches like that, but the plier will have a groove in it, and you put that groove up here and down here and crimp it, and it'll push this point down against the regular arch wire, the main body of the arch wire. So, and then we tie it there. Now, it looks something like this when you get it tied in. See, the wire will then drop underneath this auxiliary bracket, and we use double tubes on the lower arches, and the regular arch wire tube here is a convertible tube. In other words, it's just spot welded on top, and you can peel this off, because if you make any bends between this bracket here and this one back to back, then you can't run that wire through this tube, so you have to peel it off. Then it becomes a bracket, and you have to ligature the wire here, because it's just an open slot here, but it has torque on it, and then runs into a tube back here in the second molar. Now up above, we rarely ever run it back there, but we'll run an extension to this tooth if we're going to do a lot of expansion. And we run the Big Daddy arch wire into the auxiliary tube here, which is a headgear tube, and that tube is an 045 tube, 045, and it will accommodate this 040 wire very easily. As you run it through, we just make a little dog leg bend to stop it right here, and then you bring it up and tie it to the arch wire over in this area right there. So back to the lower arch wire, I'll erase all this stuff and go to the next slide. This just shows you how this wire fits in. Now my auxiliary wire are my conventional arch wires running along here, and we put these omegas in it to tie it back. So we tied it back, and the Big Daddy arch wire fits underneath that, and then lays on the teeth as we come around. Up here it kind of drops down below that omega, the tie back that we've got in there, and it moves on around the arch from there. Now here are the upper and lower Big Daddy arch wire tied in. Now we'll tie this arch wire maybe 2 or 3 spots up here in the anterior part of the mouth, which it has very little to do on that part. The work is mostly in this area, and then some in this area, as it comes forward. Or you can have less of it in the molar area and more of it in the bicuspid by playing this wire or having it formed out away from the teeth. Then you tie these teeth to it real tight, and it'll expand the cuspids and bicuspids, whatever you want, before it starts expanding the molar teeth back in the back. So that's one thing about that. Now, here is the wire the way we normally bend them. We take a piece of this pure beeswax and push it over the teeth so we can see the brackets on the teeth. This doesn't show that too good. I'm going to go on to another picture here and maybe show that. Then we form this wire over that, or you can take it and wrap it around something about the size of a broom handle, just a round pipe-like thing. You can wrap it around it. Then if you need to adjust it, you can do it with a hollow chopper and make it fit though before you activate it. You make the arch wire fit and have the space where you want it to expand in there. Now here's the upper one just tied in. You see we tied it here and here and here. That does very little. Now this one is just connected to the molar. As it comes out with the molar is connected to these by the arch wire, and it'll expand all this with more of the expansion in this area. If you want to bring this tooth out, you either have to band this tooth or you have to run a little, excuse me for these deals, we have to run something off of this tooth, go back and catch it back here to bring this out too. If you're going to do a lot of expansion upper second molar, you really should go in and band that upper second molar. Alright, there is the upper teeth with this extension, just showing it there. This is another view of the upper arch going in the headgear tube. Now this is an 045 tube, and that'll be an 040 wire, but you could use an 036, or if you're afraid of putting that much on there, you can use an 030. I would not advise putting this on some flitty patient you've got that might not come back for a month or 2 or 3, because it's going to just continue expanding until he gets his teeth out as far as that arch wire goes. Some people are afraid to use it, but I have never run a tooth out of the bone as long as I'm expanding the whole arch. You know, your groups of teeth move out and the bone moves with the teeth. The alveolar bone moves out with the teeth. And we'll show that in this next, well, not about the second case that I'll show. I'll show that how the bone moves out with the teeth. Now here we've made the arch wire fit, and then we do the expansion. See, don't try to expand the wire and wonder where it's going to fit when you activate it, put it in. So you make it to fit. And now when it's fitting in here passively, I'll take it out and bend these wires out. And you can heat treat them if you want to give them more force, but you don't really need to do that. There'll be enough force in there to expand most anybody that you want to try this on. It's real simple and it's easy to put in, and it costs almost nothing as compared to the appliances and things people have today to expand the mouth. So this is on the lower. Again, it's just got a bunch of arch wires. Now these brackets that I have here are good little brackets. I used them all the time for a long time, but back when we didn't have good sealants, food would catch underneath here, and so I stopped using them and just used a little single bracket. But you don't have as good a control over rotation with a single bracket. So these brackets are really good. Now if you've got real good sealants that you put on the teeth when you start, and if you don't brush it real hard, the sealant will stay there throughout the treatment. See, the brush doesn't get to these areas down here very good. So if you're wondering about brackets, that's a good bracket to use. Now all this mess about buying these special brackets that have no friction and all that kind of stuff, I don't pay attention to that. That is nonsense to me. We can do anything they can do with a regular bracket. So people may not like that, but that's a fact. You know, we can close the arch, and we tie the arch wire back usually to close a lot of space. And we have some cases where we close all this space on adults. You can go look at those videos and see how we do that. Again, this is the blown up picture of the molar area. I strongly recommend using these triple tubes on the upper. This is your conventional arch wire tube. This is an auxiliary tube for lip bumpers and and intruding arches and things like that. This is the headgear tube that we use to put the Big Daddy arch in on the upper. On the lower we have now these are convertible tubes where your conventional archware goes through, because if you have any bends between the first and the second molar, you've got to convert this or you can't send it through there, you see. So if we bend them, then we peel that off. They'll make it where you can just peel them off like a sardine can or something. This comes off, and it is a bracket, and you have to ligature this back to the teeth again. Okay, so these haven't been converted. We're just the way they come right here. We have a tie back wire in here. You see it coming out, and we push on this real hard and push this wire in. However, you go on one side and tie it passively where it won't move, then come to the other side and push on it with a director right in here. So you've got you push in here and you pull back on this wire and twist it down, and you can tighten an arch wire in the arch really tight, and you can close about a half millimeter of space just doing that. Just leave it alone for a few weeks and bring them back in, and that much space will be gone, and you can tighten it again. So we tie it back and put these omegas in here. We have a plier that bends these omegas, and it's tied back. We don't ever run them back and cinch them down. You can't pull them tight, and you can't take them out. If you go to take them out, then you got to cut it off, and you can't tighten it at all, see. So we can take this arch wire out by clipping this wire, and we can slip it out, put it back, shorten it, or do whatever we want to it, put it back in, tie it back again. So you don't have to change the arch wire if you put these omegas in the arch wire itself. Okay, we'll go on to the next one. That just shows it a little better, a little bigger. And now there the arch wires are in place, the upper and lower. Now frequently you don't need to expand but one arch, you see, and we can expand a unilateral expansion or a bilateral expansion with the same wire by how you use elastics on it, which I'll show in the, I think it's the second case that we'll go through here. I'll show you how we do a unilateral expansion with it. Now that's the thing lined up in there. It looks complicated. It's really not. It's about the simplest, most efficient way to expand the arches that I know of, and then you learn how to put buccal root torque in. Alright, here we're forming one over a kind of a Christmas tree deal, and you pick out a circle and you bend the wire over it and it'll form it. Now this is a wax pattern we've mashed down on the typodont, and you see the brackets sticking out. So when you form your arch wire, you lay it right in between those brackets and the teeth, and you make it fit that. Then after it fits, then you activate it, bring it out on the side. So I've said that before. I'll probably repeat myself a lot of times, and that's one nice thing about these videos. You can play them back and forth. You can stop them in the middle and back them up a little bit, and I can repeat whatever I said. The only problem with them, you can't ask me a question from running the videos, but it really helps somebody learn them. Now I'm trying to carry this tooth out, the second molar with the first molar, and I can torque this one with an arch wire, but it can't this one. So if you've got to torque this tooth, it's better to go in here and band this tooth to start with, have your arch wire going back through there. So you put a rectangular torqued tooth to bring the roots out buccally as you expand the crowns buccally. There, I hope everybody understands that. And the torque will also, you can twist that wire so that these teeth are bringing the roots out also buccally as they go out. Now, when you do that, you increase the airway on that person, you increase the whole volume up there, and so it makes it much, much better, because that's what you really need to do. Many of these young people is get airway opened, or even adults that have insufficient airway. So here it is tied in again, and that's got the arch where it's tied back. This is a tie back, and there's the upper one in the headgear tube. I've shown a lot of slides here. I hope you're not overburdened with them. Now here I'm going to show this on a lady that we expanded one of the arches, and she's about in her 50s, something like that. Now you'll get some idea how we use it, and we only use it, I think, in one arch. Now this lady's got a good facial profile. There's no problem. She also has good division of the face in the thirds. She's not a high angle case or anything like that. And we look at her from the front. She's a nice looking lady, and when she smiles, she's got a good smile line. Only thing, we see some problem in this part of the mouth right in here, where we would really like to straighten all those teeth out. Now when you look at the models, you'll see a little more problems they will have. Now this is, it looks like she lost a 6-year molar when she was real young, and this tooth's probably leaning, coming in this area right here, so we need to straighten this out, bring that back. But this is a good class 1 relation on this side. Some crowding, not a big problem on this case. Now looking at it from the front, we've got some crowding, and the teeth are leaning, and there's several things that are wrong here in the front. Some crowding down here on the lower teeth too, and this is kind of a little crossbite area back there. On the other side, we've got a tooth in complete crossbite here, and this is, it's kind of hard to see. This is class 2-ish on this side. See, this 6-year molar should be out in here somewhere, and this molar should be in this area back in here. And so there's several little problems, not any big deal. A little bit crossbite in there, not a great deal. I'm gonna go back and look at the center line. Now if these teeth were straight, the midline would be over in this fashion, so we need to correct the class 2 problem there in this case. Now looking at the arch up above, just looking down on it, this needs some expansion, and then we want to widen this arch out, or just kind of develop this arch and give it a nice curvature, and we'll have to hold that with retention. But now the arch is kind of running like that. It's too blooming narrow in this area right in here for my taste, and we'll have to expand this to line all these teeth up in the front. So these are just some things you need to be doing in there. The lower arch similar, kind of pointed like that. We need to bring this out some and form a nice arch and expand it there in the lower area. So we'll look at what we did here. I hope I did it good enough to. Now looking in her mouth at her teeth, you see the problems you've got. It's got an old bridge over here, and it's a kind of a mess, and some large molars back over in this side, and they don't fit good in here, and these teeth are leaning, and there's a whole lot of things you can do to make that look a lot better there. So we looking at one side, you can see the problems you got. That's not far from class 1 on that side, and then on the left side we have some more problems where gap there. You got an old bridge that's let this tooth drop down into the bridge. We kept the bridge. We didn't want to really get in here and take a bunch of stuff out on that. So we come in and we'll bracket this case, and then we'll use, and you've got some rotations in here. This tooth badly rotated. This was a little bit here too. And you're going to we're going to expand this lower arch. Now I've been told in the past that you couldn't expand the lower anterior teeth and expand the cuspid, they would always go back. And we have expanded some of them almost twice the distance, and it's been out 20 or 30 years, and it's still out there. See, so don't buy that. It was researched by a wonderful guy, but I think what they did, they didn't bring the roots of these cuspids back when they expanded it. If you tip them back, I've had my own experience with it, they stay back there if you tip them back. They don't crawl back up there, have some sacred knowledge to return to a certain spot just because they were there when you started it. So not like the monarch butterfly and goes back to Mexico every year. So here we are. We've done a lot of this already. This is pretty far into treatment now. So we've already expanded and lined up and everything like that. And here we need to bring this out a little bit. And with our arch wires, we've kind of developed the arches. I think I'll show this big daddy arch. I hope I do, since I'm talking about it here. So here we're going along pretty good. Everything's lined up. Now when we look at it from the top, see, we've begun rounding this out. This is not a lot better than it was to start with, and we'll expand it, and then you've got to put some buccal root torque. See these roots, the cusp of these teeth will get a little further down than the buccal cusp, so you need to keep them in and put that buccal root torque in those rectangular arch when you get into it. Well, here it is. We didn't use one, I don't think, on the bottom arch, but we did on the top arch to bring it out further. And you can expand anybody. I've never run into a person I couldn't expand their arch with one of these. It's just phenomenal. I've done this on 80-year-old people, and you can expand arches like mad with them, and you just be careful. I have never run the teeth out of the bone when doing that. When you bring a group of teeth out, the alveolar bone moves out with them, and if you watch that case long enough, the basal bone will shift to support the alveolar bone in the best position possible, and it'll shift to do that. Yet that's a hard thing to get across to people. We had a bridge here, and I just kept this bridge. I just bonded to it and brought it out. I didn't want to redo this whole bridge for this lady. I'll have somebody else redo it. So anyway, we've gone out like that. Now we'll come back when we get it expanded where we want it, and we'll put the buccal root torque in a rectangular arch wire. Then you've got to hold it out when you put this buccal root torque, or it'll make the crowns go back in. As you try to torque the root out, it'll try to bring the crown in. So you need to put that on while you've got your expansion, or have an arch wire that you put it in that you've expanded it. So you don't want to put buccal root torque on a tooth. It will actually make lingual crown torque, and it'll move the crown in. That's some people don't know. Now in bonding, I just bonded to a portion of this bridge to expand it out and got it up enough to where we could fix it up where it would occlude against the teeth pretty good. So now the midline looks pretty good. These teeth are lined up pretty well, and that's pretty good class 1 cuspid looks like from this point. Coming over here, really it needs to go back further and I don't know that I got it all the way that I would like to, but we're going to make it look a lot better anyway. Now, the upper arch is expanded out. We have a rectangle arch in there, so we put the buccal root torque, and that'll bring this root down and this root up. This point, cusp down, this cusp up right over here. It'll kind of level the tooth out as it goes. Now we've got rectangular arch in the upper. I think we're still in a round one on the bottom, and we've pretty well got the buccal root torque and everything done, and we've got the expansion, everything put in on the case. This tooth right here, we need to bring it down, which we'll check and see later if I actually did that. And here's the bridge and the teeth going back. Now we have rotated this tooth quite a bit. You'll notice the bracket is over on this side because we pulled it around like that. Now what we've done here, we hooked a half hitch in this and went around this and hooked it on this bracket, so it spun it around like that. Now we'll need to change the bracket, put it on the real buccal part of that tooth. Now let's see. So we need to bring a little more out here, and this tooth needs some buccal root torque in it to raise these cusps and drop these cusps down here and bring this tooth out into proper relation with the opposing tooth down on the bottom. And we got a little space in the arch as we went in there. We expanded and got plenty of room for the lower anterior, and we'll try to close up most of that space when we get out of here. So here we are, the thing's coming along a little bit better, and I think I have a rectangle arch in both upper and lower arches at this time. Now here it shows the cuspid. You see, when we started was there, and we needed to bring it back there, and this tooth back here, this one here, and this one here, see, to correct the class 1 relation. And that's pretty well taken place. So you see the cuspid going in here, the bi pretty well there, and the molar back there. Now I've got a little space right there, but we can close that probably with a retainer. So this right side of the mouth is all moved back some in this direction, and maybe the lowers come forwards a little bit, but we have pretty well corrected the class 2 problem that we had on this side. Now we'll probably show on the x-ray that this tooth was leaning. It probably, that lady lost this tooth when she was very young, and it drifted, the crown drifted over, and the roots didn't drift far enough to keep it parallel. Let's go on now to the anterior view. These teeth were leaning a lot. I see I didn't get them actually straightened out as good as I would like to have, but looks pretty good. And this is class 2 correction on the right side, and I'll have to see what the left side is when we go to the other side. Now this had a mild class 2. The cuspid just needs to go there, and this bi here, and this one would have to come back in this place where this is moved out. The molars move forward too far, so we have to back them up to fit into this bridge. Now the patient had these teeth crowned, if I remember correctly, and that fits better into the bridge that they had on the bottom arch. It's not an ideal situation, but it's maybe better than leaving it alone like it was. Now observe the curvature in this. You see how this is curved out, and this side over here is curved out quite a bit. This distance across here is greater than it is across here. And even if this tooth were in line, it's still greater. So we move these teeth out and also these teeth out as we developed it. And I paid no attention that you can't develop an arch, you can't expand them. We put retainers in there and hold them. And you know, I've looked at some of these cases 20 and 30 years out, and they're still looking good, you see. So you can do a lot of things that for a while people were saying you couldn't do these things. So this arch is developed out and looks a lot better now than it did to start with. Now the lower arch is considerably expanded, and we of course put a 3-to-3 retainer in here, which you'd want to maintain for many years after you get through this, but the width across here and across here is tremendously different. And this arch is way out like that. And I've watched this lady several years after we finished, and this is staying with her, you see. So this is the bridge that she has. We lined it up. I think she worked on the crowns up above the bridge where it fits better though. Now here is the x-ray deal. Now this tooth is leaning and the crown's going up like that, so we kept the bridge so we can't naturally change the effect of these teeth. This one we're going to try to move these roots forward a little bit. So she lost a 6-year molar when she was a little girl, apparently, because that drifted together quite a bit there. Other things, the bite's a little deeper, and we open that up. So now here's the second Panorex we took on her. Now that's with this big daddy arch wire in there where we're expanding the teeth. And the bottom arch we did some expansion with the arch wire, but I didn't use the big wire on that. Now this is 1993, and I've got something on her age, I think it is. So it's the third Panorex we took, and these roots are still way out. I haven't got them like I'd really like to have them. Now here they're a little better, bringing the roots together are better, and we're taking this thing off. The crown is lined up good here, and that's what we wanted majorly to see. This tooth, the crown looks good, and then the root kind of heads in this way. Excuse me. Maybe we can edit that cough out. I don't know, but things happen when you get in here and start talking. And but the roots look pretty good on the teeth, so we're going ahead with like it is. And here is the more or less the final result. Lady looks a lot better. Of course, she's dressed up now, got her hair fixed and her face fixed. Naturally, they're going to look better. But she's got a good division of the face and good profile, good facial structure that you can do a lot orthodontically with. Well, when she smiles, she's got a beautiful smile now, and you see this area looks much better. You see teeth all the way back on the smile. That's what I really like, the smile like that. Now here it was to start with. You see how this was. Now I don't know what she's done cosmetically, but she looks younger over here. 2 or 3 years after we finished than we did before we started. The wrinkles are gone, or most of them, so I don't know what. I didn't do that orthodontically. I didn't use any Botox on her either, so it looks a lot nicer there than it did to start with. And that's and we've taken quite a bit of time going through this, so I think I'm going to divide this into two videos, and we'll do these last. I think there are 4 more cases, but to get in there and do all of them at one time, you get kind of bored with it. So I'm going to stop the video on this one at this point, and we'll come back with a second phase of this Big Daddy arch.